Hi everyone, it's Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna. Today we're talking about neck pain. And we're going to talk about how chiropractic can help neck pain and what you can do if you have neck pain, what kind of treatment you can get, and then how to take care of yourself if you've been suffering from it. So again, my name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna. I'm just going to switch screens so that you can see my presentation. I'll try and stay in the bottom right corner for you, but sometimes if the slides, if you can't view them, I will turn off my camera. So I'm Dr. Cary Yurkiw. I'm a chiropractor with 3 decades of experience now. This is my 30th year of practice. I'm the owner of Tut Street Family Chiropractic, and my journey into chiropractic began by overcoming knee pain, sparking a passion to help others through chiropractic care. I suffered a lot when I was a young teenager with knee pain, and at that point my family took me to a chiropractor. He examined my knees, took x-rays, and basically found the cause of my pain and did treatments to help me. I'm excited to provide information about chiropractic care and the distinctive services available at our clinic, from defining chiropractic principles to showcasing our holistic approach and diverse services. So we have many services here, and I'm going to go over some of those today. And let's go over the causes of neck pain. So what are the causes of neck pain? Poor posture can be one of the causes of neck pain. So sitting or standing with your head tilted forward, your shoulders rounded, or your back hunched can stress your neck muscles and joints, leading to pain and discomfort. And that's something that I see commonly here in the clinic, is people that have poor posture and they have a neck pain as a result. And especially these days where people are on their phones a lot and they tend to be slouching forward, what I call text neck. So that text neck is when you're looking down and you're causing the neck to flatten and causing a bump in the back part of your neck. So we want to prevent that kind of posture with that rounding in the back and that bump in this area right here, which can result in neck pain, and that neck pain can travel into the shoulders or even down the arms. Muscle strain is another cause of neck pain. Overuse or injury of neck muscles can cause inflammation, muscle spasms, and tenderness. Everyday activities that can strain the neck include lifting heavy objects, sleeping awkwardly, or holding your phone in between your ear and your shoulder. So definitely don't do that, but also using your neck at work, in sports, those types of things can cause muscle strain in the neck area. Injury, trauma to the neck, such as car accidents, whiplash, sports collisions, falls can cause whiplash, a sudden or forceful movement of the head and neck. Whiplash can damage the neck's ligaments, discs, nerves, and vertebrae, resulting in pain, stiffness, and reduced range of motion. So injuries like whiplash can also result in neck pain. And then finally, degenerative conditions like aging and wear and tear can lead to changes in the cervical spine, such as osteoarthritis, disc degeneration, spinal stenosis, and herniated discs. And these are very common things that we see in the clinic. These conditions can cause inflammation, compression, irritation of the spinal joints, discs, and nerves, leading to pain, numbness, tingling, and weakness in the neck and the arms. So what is the chiropractic treatment for neck pain? Well, chiropractic is safe, gentle, and effective. So when we do treatments in the clinic, we want to make sure the patient's comfortable. We want to be effective with the adjustments we're doing. And we have a number of different methods that I'll review with you at today's webinar. So what we do when people come in is the initial consultation. And what I ask patients is their medical history, symptoms, their lifestyle, and their goals. We will also perform a physical examination of the neck, spine, and posture, and may order some diagnostic tests such as x-rays to determine the cause and the severity of the neck pain. The examination, the chiropractor will assess your cervical spine's mobility, alignment, and function, and identify any joint restrictions or misalignments contributing to your neck pain. We'll also evaluate the neck and arm's length, reflexes, sensations, and check nerve compression or damage signs. These are called orthopedic and neurologic tests. For a diagnosis, based on the consultation and examination, I diagnose the condition of the patient, explaining the underlying cause of the neck pain. Then I discuss the treatment plans and the different options for the patient, the risks and alternatives, and answer any questions. Then, when the patient consents to the treatment, the next step is adjustments. So adjustments, otherwise known as spinal manipulation, is when the chiropractor uses their hands or a device to apply a controlled force to the affected joints in the neck, aiming to correct the posture and restore function. Spinal manipulation can reduce inflammation, improve blood flow, and relieve nerve pressure, resulting in pain relief and improved mobility. So adjustments to the neck can really help. I find it actually quite easy to adjust the neck from a chiropractic perspective. It's just a matter of doing the right types of adjustments for the patient and whatever they can tolerate at the time. So that's the goal. But adjustments are very effective in the neck to relieve neck pain. Oops, sorry guys. Okay, so I'm going to go to the next slide right here. I keep running into this problem. 1 second. Okay, so research evidence for chiropractic care for neck pain. So what's some of the research and the evidence related to chiropractic care for neck pain? A 2012 study, which was a randomized controlled trial, compared spinal manipulation, SMT, medication, and home exercise for acute, meaning short-term neck pain, and subacute, which is a little longer term. And the results showed that SMT was more effective than medication in both short and long term and had similar effects as home exercise. So that's positive. In 2017, systematic review and meta-analysis evaluated the evidence for SMT for chronic neck pain, that's long-term neck pain, and the review found moderate evidence that SMT was superior to sham SMT or no treatment for pain relief and function, and low to very low evidence that SMT was better than other interventions for short-term and long-term outcomes. And then the last thing is that a 2019 randomized controlled trial compared SMT and mobilization for chronic neck pain, and the results showed that both SMT and mobilization were effective in reducing pain and disability and improving the quality of life of the patient, but there was no significant difference between the two techniques. So those are the research studies that were done recently in the last decade. Sorry guys, I keep getting the research articles up here and I don't want that. So I'm going to go back to this. Somehow that keeps showing up for me. Instead of the mouse, I'm going to just click forward on the keyboard to see if that'll help. So the next thing is hands-on and instrument adjustments. So for hands-on and instrument adjustments, we incorporate different techniques in the clinic, And the techniques involve hands-on and instrument adjustments like the activator or integrator, drop table adjustment, Y strap, decompression for the neck area. So depending on what's going to work best for the patient, what I will do is use hands-on traditional chiropractic. Sometimes I'll use instruments like the activator or integrator to realign the neck and improve the function. And then we use Y-strap decompression, and that's something you might have seen on social media, where we traction the spine, open up the spaces between the bones for the nerves. And almost all patients really like the Y-strap and the adjustments using the hands-on and the instruments. They just feel so much better from those adjustments. Now, these tools are more contemporary, so the activator and integrator are something that are newer to chiropractic but have been around for a while. They're gentle and effective, and they're very suitable for sensitive areas. So if there's a lot of inflammation right after a car accident, let's say, then these techniques tend to work really well. And by the way, if you do have a car accident, it's important to come in as quickly as possible, because if you let it go too long, what can happen is a scar tissue can develop. It gets harder to work with. So when you have a car accident, call ICBC in British Columbia and then come in to the clinic right after that. For hands-on adjustments, also termed manual adjustments, these involve skilled and precise movements to manipulate the spine and the joints. And the objective is to restore proper alignment and function through posture and joint correction with the adjustments. So that works very well. And so that is something that we do in the clinic, and I've done that for a long time now. Now let's see if I can advance this slide without causing too much disruption here. Good. Now, shockwave and laser treatment. Now, shockwave and laser are two different therapies, but equally as effective. Sometimes one therapy works better for a certain area or for a certain individual. So for shockwave, it's acoustic waves, and so sound waves, and the shockwave therapy is non-invasive that utilizes acoustic waves to stimulate the body's natural healing process. The technique is particularly effective in managing chronic pain conditions such as tendonitis, plantar fasciitis, shoulder impingement syndromes. Shockwave therapy promotes tissue regeneration, reduces inflammation, and accelerates the healing process. Now, laser therapy is light therapy. So we use laser therapy to provide drug-free pain relief and promote tissue healing. Laser therapy involves the application of low-level laser light to targeted areas of the body. It helps to reduce pain, inflammation, and swelling, while also enhancing cellular regeneration and promoting tissue repair. So I use both on a daily basis here in the clinic, and it depends on what's working better for the patient. Sometimes I'll alternate shockwave and laser in a certain area to see which one's working better, and then go with the one that's more effective for that patient. Sometimes I'll use just one technique because it's going to work better for that particular condition. Now, transforming health through coaching. One of the things that I offer here in the clinic that's unique is health coaching. And the reason I offer health coaching is because of my experience, how many years I've been a chiropractor, but I've also written some books. Books on neck pain and back pain on Amazon, books on joint healing, and also on your diet, nutrition, and weight management. So we have a very holistic approach here in the clinic. And for health coaching, when people need extra help, whether it's stretching for a certain area, whether it's posture in their desktop setup, or maybe it's just nutrition and lifestyle changes, that's something that I offer. And I will incorporate those sessions right into the care plan so that I meet with the patient on a regular basis, like doing treatments or adjustments here in the clinic. And then sometimes I do that via Zoom or Google Meet, where they can be at home or at work, and then join a Zoom call where I'll meet with them one-on-one and discuss things they can do. It also holds the patient accountable to making changes. So I find the coaching sessions very good for transferring the responsibility from the treatments in the clinic to the patient. So the patient has to do exercises and stretches at home. And I have an outline that I use, and then follow-ups using that outline, similar to this PowerPoint presentation, where we build on the previous sessions, keep working at it to get the patient to a higher and higher level of function. Now, we do have products in the clinic, and what we do with our products is we have neck supports, back supports, we have nutritional products for the joints, we have pain relief products as well, and these products help the person to heal quicker. So depending on what stage the patient's in, pain relief, whether they're working on their posture, they need a neck support for the car, they need to be immobilized right after a car accident. We have these products in the clinic that I recommend to the patients so that they can help support the healing of their neck. Another thing that we do here in the clinic is we do follow-ups, and we'll initially assess the patient based on what I said earlier, and then we'll do treatments, and then we'll do re-examinations. So at the re-examinations, it's a good time to check in and see how the person's doing in general. How much better is their pain? How much more flexibility do they have? And then also do postural pictures to compare to the initial visit. So I like to take postural pictures at the beginning, then when I do re-exams, take postural pictures, and then we can see the progress of how the alignment is improving, how the posture is improving. So we use these tools to gauge and measure how the person's progressing in the clinic, and I like to do those checkups on a regular basis. So depending on how often the patient's coming, I like to do that every few weeks, and then just see how the person's doing with the care. Are they on track? Are they ahead of schedule, or are they behind? I also think that does lead to transparent communication, because people like to know how they're doing. So I think there's some accountability there. People want to know that we're on top of things as practitioners, and people want to know how they're progressing and what to expect going forward. So I think that's very important for the progress for the patient. So in conclusion, the key takeaways from today is that we delve into the essence of chiropractic care, showing our unique approach, emphasizing holistic healing and individualized treatments. Our services here range from chiropractic adjustments by hand to instrument adjusting, shockwave, laser. We do orthotics in the clinic, and we have healthcare products. And then, of course, we have the health coaching to help people with their health. You can schedule a free phone or online consultation, and I'll put the phone number in the show notes below, but also you can click on the link in the show notes, and then you'll be able to go over to our website, and then you can book an appointment there. So you'll be able to go on to, I'll just pull up our website so you can see it, and you can go right on to our website right here, and then just click on book now. And if you're a new patient, you'll click right here, and then you can book an appointment online. It's pretty easy. Once you click on this, you'll be taken to a scheduling screen, and then you can enter your information, click on the service, the initial visit, and then you can actually find a day and time where it's convenient for you to come into the clinic. You can spread the word, tell other people about the clinic. We are accepting new patients without a doctor referral, so you don't need to be referred by a doctor to come and see us. We bill directly to insurance, including ICBC, so feel free to tell people about the benefits of coming to the clinic. We have same and next day appointments often available, so that's very good for the patients as well. And then for the next seminar, which we're calling Dinner with the Doctor, it's on the benefits of shockwave therapy for tennis elbow. So we're going to talk about a specific condition that chiropractic and shockwave can help with. That'll be March 14th at 7 p.m. So I look forward to seeing you guys at 7 p.m. on March the 14th. In the meantime, if you have any questions, you can type them in the chat or message us directly at the number that I gave you in the show notes here at the clinic. And when you go to get a ticket for future webinars, I'm just going to bring that over. You can go to Eventbrite, and that looks like this. And when you go to Eventbrite, you can type in the, you can click on the link, or you can type in Yurkiw Chiropractic at Tut Street, on Tut Street. And then what you can do is click on here, reserve a spot, and you'll get a ticket for the next event, which is March 14th at 7 p.m. Generally, these sessions will last about 30 minutes. So go get a ticket, and then Eventbrite's going to send you a link to the free webinar. Tickets are free, but there is a limit to the number of tickets, so please go on to Eventbrite and get a ticket. And like I said, if you have any questions, feel free to reach out to the clinic and let us know. Thank